The stronger your muscles, the patient's muscles are before surgery, the easier their rehab's going to be. So I tell patients if you can exercise to the degree that you can to try and get your muscles stronger. This is a particularly important topic for women because what happens is women tend to delay surgery longer than men, and they have more muscle weakness before the surgery as compared to men, and so it's harder for them to get that strength back after surgery. So the exercise after surgery is very important, but really we would make more gains if we could focus more on the muscle strength before the operation. But that's hard for patients though because they're in pain because of their arthritis, so it's a little bit of a challenge. When patients first get home, I ask them to try and take it easy a little bit. They should have someone at home with them. They don't have to be there 24/7, but they shouldn't go home and be home the first couple days without anybody there for a long period of time. So usually we're hoping that the spouse can take a couple days off of work to be home and just around in case the patient needs some assistance. We encourage you to be active and walk and do your exercises. That's really important. I tell my patients, please take your pain medicine. I promise I won't turn you into a dope addict, I promise. And it's important that you take your pain medicine so that you can do your exercises and move around, which is going to speed your recovery and then get you off the pain medicine sooner. My philosophy on driving is that obviously you can ride in a car and someone can drive you. You can drive the car yourself when you're walking with your cane after the surgery and you're not needing any narcotic pain medicine while you're driving. So typically after a couple weeks my patients will be using the cane and I tell them get up in the morning, take some Tylenol with your breakfast, go run your errands, come back home, you'll be a little tired and fatigued, take your narcotic pain medicine and then you're in for the rest of the day. But then as time goes on, that period of time when they're not requiring the narcotic pain medicine will lengthen, as typically the last narcotic pain pill is the one at night. In general, most people are through the majority of the rehab a month after surgery. So most people are doing pretty well a month afterwards, but it can take upwards of 3-6 months, sometimes even a year to really get to your maximum potential after the surgery. But for most people, they're doing pretty well a month out. Some even after 2 or 3 weeks. After knee replacement surgery, exercise is very important because a lot of the therapy is basically exercise. And mostly it's exercise to strengthen your quadriceps muscles, which are the muscles in the front of your thigh. Secondly, it's exercise for balance to make sure that you're safe when you're walking with first a walker or crutches and then a cane. And third, it's exercise to help minimize some of the swelling that you can have in your knee. So we love for people to exercise. And then after they've recovered from the kind of acute post-operative period, we encourage people to walk, swim, bike, play golf. We don't like people to run for exercise because it's a pounding activity. So we discourage jumping, running, kind of impact activities. Now you could do it if you had to. I mean, if you were certainly in an emergency situation, you could run, but we don't encourage actual running. So I wouldn't want you going back to your marathon after your knee replacement surgery. After surgery, we have patients come back for periodic checkups. And then after the first year, we stretch that out, and I'll see them every 2 or 3 years, depending on their age and how they're doing. So that really varies by patient. But periodically, we do want to check patients, and we do want to get x-rays, because if the implant is starting to wear, we can see changes on the x-ray, and the patient won't be able to feel that or know that. So it's important that periodically the patient see their surgeon and have an x-ray to have the knee checked. But it doesn't have to be all the time. And here's where I give patients a little bit more of a cautious answer. And I say that this knee replacement that we're putting in you isn't as good as the knee that you had when you were a young person, okay? We are not nearly as talented or skilled as our Creator who designed us. But it will be better than the worn out knee that you currently have. So I feel good that the surgery is going to help them and help them considerably. But I try and caution them to have the right level of expectation that it is not the same as a normal knee. It's not the same as the knee they had when they were 20 years old. So there are, it isn't quite the same. It's not as good. But for most patients, it's a huge improvement. And I also tell them that it's still possible that they can have some discomfort after the surgery. Because you know what we do with the surgery is we cut away the arthritic joint surface, but there's still other structures around the knee that can be injured in the future or have pain, like tendons and muscles. So having knee replacement surgery is not a guarantee that you're never going to have a lick of pain in that knee for the rest of your life. So it's important for them to know that too.